There's been a major medical breakthrough in Japan. A woman with a condition that should have prevented her from ever giving birth delivers a healthy baby boy. It's thanks to a cutting-edge fertility treatment called in vitro activation. Dr. Jamie Grifo is a program director at the NYU Fertility Center. Doctor, great to have you here.
Thank you.
There are obviously many different causes of infertility, but the diagnosis of POF is usually one of the most devastating. Very quickly, what is that?
Well, fortunately, it's very rare. It affects a small percentage of young women, but it's a young woman going into menopause before her time, so to speak, and therefore losing her chance of being able to have a baby.
Because she doesn't have any eggs. And of course, you cannot have your own biological baby if you don't have any eggs until now. What did these doctors in Japan do?
Well, this is where it's so great, where you do translational research. They go into the animal lab, they do a bunch of experiments to figure out what the mechanisms are. They understand it, and then they take their findings in an animal lab and then apply it to a clinical problem. They took ovaries out of these women, cut them up into little pieces, put them in an environment where they could grow bigger, and therefore able to rescue the follicles and actually get eggs from ovaries that otherwise would not produce eggs.
That's incredible. So just the ovarian tissue was able to grow eggs. They tried this on 27 women. They were able to grow eggs in 5 of them, and 1 of them went on to have a healthy baby. So it's still a long shot.
Well, and naturally 1% to 2% of these patients will have a spontaneous conception anyway, so it remains to be seen how much of an improvement you can achieve with this, but the fact that they were able to get ovulation and eggs in these patients is very remarkable and offers a lot of hope for these patients. But it requires 2 significant surgeries, 2 laparoscopies to get the tissue and put it back, and then in vitro fertilization, so there's going to be cost barriers and other things, but this is a big promise for, an offer of promise for these patients.
It is a big promise for people with POF, which is, as you said, sort of premature or primary ovarian failure. What about for women in their 40s who, as we always hear, are running out of their eggs? Can they also grow new eggs using this?
Well, that remains to be seen. That's what an investigation is going to have to be done to see if they can make better eggs from women whose eggs are older and not as good. And that's experiments to be done if this truly works. But for this young group of women who have ovarian failure, who only can use egg donor as an option now, this potentially gives them the chance of using their own eggs, which is remarkable.
How soon do you think you'll be able to use it in your practice?
Well, I think it's a long ways away. It's still in a very experimental phase. There's still a lot of safety studies that need to be done. There's also the risk of the surgeries that are done.
Sure.
It's a big deal, but you know, this first step is really remarkable.
It does give many women new hope. Dr. Jamie Grifo, thanks so much. Great to see you.
Thank you.